Who are the ad watchers? We are attorneys at the National Advertising Division of BBB National Programs, a team with over 50 years of experience investigating and resolving disputes over the accuracy of national advertising campaigns.
We don't just take ads at face value, we put them to the test. Why? Because advertising law can be simple, but it's the execution that's hard.
Welcome to the Ad Watchers, NAD's podcast that gives a view into how our organization reviews claims and applies advertising law. If you missed any of our previous episodes, don't forget to check them out later. They're available wherever you're listening to this.
We're up to episode 4, and we're doing a deep dive into a topic that is always top of mind for competitor challenges and monitoring cases.
That's right, Annie. Today we're going to talk about health claims, a topic we've discussed before, but we thought it was a good time for a checkup on health claims. Always a good time for a health checkup, and if my doctor or dentist are listening to this, I'm making that appointment as soon as we are done recording. But today we are talking about health claims and checking in on what is happening at NAD with health claims, just to see where we're at, because it's always an issue that's top of mind, but there's an interest in new and alternative treatments that's out there and changing and developing government policies. So we thought it would be a good time here in the middle of 2025 to take a checkup and see where we're at and go through the rules of the road and look at some of our recent cases. As you'll see, health claims can cover many different product categories, from dietary supplements to devices, all to food, to all kinds of things that may convey a health claim. But the key consideration is always whether there's a good fit between the claims and the support. Health claims are held to a higher standard of proof. A reasonable basis here requires advertisers to provide competent and reliable scientific evidence. Sometimes we shorthand that to CARSE.
We harmonize our decisions with relevant regulatory authority. 2.5 years ago, the FTC issued its health claims compliance guidance, which covers all health products, and it provides really detailed rules of the road. We actually covered this at length in season 3, episode 1. So I'm not going to go through all of the points we made there, but the health claims guidance reaffirms and explains that what competent and reliable scientific evidence is, which is randomized controlled trials, or RCT, so randomized double-blind placebo-controlled human clinical trials. The guidance explains that you need to have detailed protocol at the outset, with inclusion, exclusion criteria, dropout rates, noncompliance. It has to be of a sufficient duration to assess the effect of the treatment and has to go into the adverse results. Another point that the guidance makes is that companies should not engage in p-hacking or the manipulation of statistics to get better results than the actual ones. So, for example, running a post hoc analysis or tests after the fact, right? And focusing on one reliable aspect of the study and ignoring the rest. On the FDA side, the FDA recently issued its final rule entitled Food Labeling, Nutrient Content Claims, and the Definition of the Term Healthy. And this is the first update, actually, since 1994. And this is important because, consumers are seeking out healthier food options, because they want to live a more active lifestyle. We see it used in, product names or describing different products like Heart Healthy Trail Mix. And so the guidance revises the requirements for when the term healthy can be used as an implied nutrient content claim in the labeling of human food products. And it also does other things. So, for example, it limits the amount of added sugar, saturated fat, and sodium in foods that can carry a healthy claim.
So turning to NAD, we have had competitor challenges and monitoring cases recently uh, in this space. And, mirroring what's out there in the marketplace, we've heard a lot about GLP-1 treatments and the growing popularity of those over the last year or two. So we had a few competitor challenges where the manufacturers of products like Zepbound and Mounjaro and Ozempic challenged claims made by compounding pharmacies who provided what were marketed as alternatives to these popular products. So we had a series in cases involving these products which contain tirzepatide or semaglutide. A series of these cases, and in all the cases, the advertisers voluntarily discontinued the claims. But the claims, it's worth noting, what the claims were in these cases. Although NAD did not look at them on the merits, they were marketing more effective treatments in terms of weight loss than the GLP-1s that are on the market. More effective treatments of diabetes, providing more vitamins that give you an energy boost, fewer side effects like the nausea that might come with the GLP-1s, or easier administration, which you're able to skip the needle with these products. But in all these cases, the claims were voluntarily discontinued. But it does certainly indicate that we are going to see and bring monitoring challenges in areas where there are very aggressively marketed categories of products or emerging products that consumers are very interested in. Then also, we've had a few cases where a few monitoring cases where the claims involve claims of brain health. First, we had a case involving the advertiser was Ingenuity Foods and had to do with their line of Brainiac brain squeezing applesauce sold to kids and Brainiac brain pack adult gummy vitamins. So these products came with kind of brain power boosting claims. NAD found that the nutrient claims based on the nutrients in the products were supported. Claims like supports immunity, Brainiac snacks help close the brain nutrition gap. These backed by science, loved by families. Brainiac partnered with parents, pediatricians, and neurologists to create a line of delicious snack favorites packed with key nutrients that fuel the body and brain. These claims were supported based on evidence having to do with the nutrients, the ingredients in these products, like vitamin C and other ingredients. Also, NAD found a claim that the products are designed to help fill a nutrition gap. These claims are supported based on the WHO's recommended intakes of certain nutrients. For example, most kids only get 20% of the recommended daily intake of omega-3s, the most important building blocks of the brain. That is precisely why we formulated brain squeezers with our proprietary brain pack, a blend of DHA/EPA and choline to support the development of big, healthy brains. And then the claim went on to explain that they are based on these WHO recommendations. So NAD found that the products having the nutrients in those amounts that the claims were supported. But claims that went a little bit further in terms of conveying a message that the products provided cognitive benefits beyond simply supporting brain health, NAD found that those claims were not supported. There were a series of studies submitted based on the ingredients in the products, but not any studies that tested the ingredients in the concentrations available in the product. Despite some literature being submitted, NAD found that the claims were not supported when they crossed over into the line of making a claim of cognitive improvement. And then finally, we had another case involving brain health claims. This was another monitoring case where the advertiser voluntarily discontinued the claims. These had to do with MOSH protein bars was the product here. And these products were advertised as being able to crush cravings and give you a mental boost and set you up for long-term brain health. Bye-bye brain fog. These claims were voluntarily discontinued.
So switching gears a little bit to dietary supplements and drugs, we had one recent case concerning MitoPure cellular nutrition. So MitoPure was making claims about cellular health. So, for example, clinically proven to revitalize mitochondria and boost muscle function, and the first nutrient clinically proven to trigger mitophagy, preventing age-related cellular decline. And they were also making muscle strength and endurance claims. And these were quantified claims. So muscle strength increases up to 12% in 16 weeks. Muscle endurance increases by up to 15% after 8 weeks. MitoPure has one ingredient, 500 milligrams of urolithin A, and that's an ingredient that's found in foods such as nuts and pomegranates. The study showed that certain mitochondria gene sets associated with aging and muscle function are positively impacted by urolithin A, including the dose that's found in MitoPure, which is important. And that happened at a statistically significant degree. So we found that the cellular health claims were supported, except for a modification to avoid referring to the first nutrient, clinically proven, because there was insufficient support for that. But as to, for the muscle endurance and strength claims, the endurance claim was supported by a study that tested double the dose of MitoPure, so it wasn't sufficiently reliable to support that claim. As to the muscle strength claim, it did. One of the studies actually tested the Sync studies tested the amount that's found in MitoPure. But the problem was there's a disconnect, right? So the ads showed these athletically built individuals engaged in exercise, and the Sync study assessed sedentary, obese, middle-aged adults. And so we recommended that the challenge claims, including the boost muscle function claim, be modified to reflect the results of the study, in that it's the result related to the hamstring muscle in obese, sedentary, middle-aged adults, and that the context of the advertising should avoid conveying that the results reflect what these athletic built adults can achieve. Our dietary supplement cases really run the gamut in terms of the target audience. In a recent competitor challenge that was appealed to the National Advertising Review Board, or NARB, a Bayer challenge claims made by Ollie for its Chillax dietary supplement. And this is a dietary supplement that is targeted to children, specifically, younger children. So at issue were expressed claims that it supports a calm mood, relaxed mind, and staying engaged. Ollie provided a 4-week RCT involving 106 healthy male and female children ages 4 to 15, and it used different scales to assess anxiety and depression. There were a number of problems, including that some of the scales didn't assess the 4 and 5-year-old kids to whom the ads were actually targeted. There were also there was a lack of statistically significant results and also conflicting results. And also there was no assessment as to how the subjects stayed engaged. There were also expert reports and other studies on one of the ingredients, L-theanine, which did not bolster the support for the claims. So we recommended that they be discontinued or modified to be consistent with the results of the underlying testing and research. And on appeal, the NARB affirmed NAD's decision. And the next case is relates to Kisqali. This was a challenge by Eli Lilly against Novartis. Kisqali is a drug that treats metastatic or stage 4 breast cancer. Eli Lilly manufactures Verzenio, which treats the same condition. Now, all but one of the challenge claims were permanently discontinued. So we looked at just one claim, the express claim, the only drug in class with consistently proven overall survival benefit in HR plus HER2 metastatic breast cancer. And that was actually going to be modified to be accompanied by the phrase across 3 phase 3 trials, or a similar claim to that effect. So we looked at the modified claim. Now, what I want to touch on is the audience, right, to whom the claim was addressed. So we had advertising that was directed to lay consumers, but also advertising that was directed to healthcare professionals. We found that one message reasonably conveyed to consumers by the only drug in class claim is that Kisqali is more effective and provides superior survival benefits to other drugs in its class, including Verzenio, and that patients taking Kisqali will live longer than when taking any other CDK4/6 treatment, which was not supported when advertised to a lay audience based on a number of reasons, including the methodologies of the studies, the lack of statistical analyses, etc. But that wasn't the case for the healthcare professional directed ads. Now, obviously, even a sophisticated audience needs truthful and accurate advertising. But here we found that the challenge claim was supported when it was directed to this audience. Oncologists are more capable of discerning that the comparative claim being made was as to clinical data points and not an implied claim of overall superior efficacy as it was presented in the brochures and other healthcare provider-directed materials. There was also detailed information about the parameters of all 3 studies. There was a graph, extensive drug and safety information, and other notes about issues relating to toxicity, adverse reactions, etc. And so we felt that oncologists would understand that despite the statistically significant survival outcomes in more trials than Novartis's competitors being a promising result, it's not conclusive that Kisqali provided superior survival benefits or superior survival benefits to all classes of patients.
And then we had a few recent monitoring cases, which should be of interest to serious athletes and weekend athletes, having to do with claims of knee pain relief, injury prevention, and some sports performance claims. First, we had the case of Victory Performance Insoles. That's Victory, VKTRY, one of those vowelless brand names. So we had this case, and the advertiser made certain claims that using these insoles could help you jump higher, run faster. Some of those claims were quantified in what you could do to your running speed times and your vertical leap. And then also some claims having to do with injury reduction. Very important to athletes who are engaging in vigorous sports like football and basketball. So we had a look at the evidence to support these claims, and they could not use data that was meant to support the insoles for their use in treating plantar fasciitis for broader claims about being able to jump higher or run faster. And similarly, the injury reduction claims, along with the performance claims, were advertisers sought to support them by with some studies where the methodology was not clear to NAD, so NAD could not accept them as substantiation. For example, there wasn't a statistical analysis that came with the studies. It was unclear what the baselines were used in these studies in terms of measuring performance and injury reduction. So it was and then it was unclear as to how you could track injury prevention with these based on this data. Also, these claims were made through some of these claims were made through endorsers such as an NFL running back or the parent of a high school volleyball player, and NAD took the opportunity there to remind everyone that you cannot make claims through an endorser that you cannot make yourself. So claims were voluntarily discontinued in this case. Next, and finally, we have the MagnaLife knee pain relief soothing gel case. So this was a gel product that was advertised for rapid pain relief for the knees. And one of the claims was also that you could say goodbye to knee pain without surgery. Fast-acting gel reduces pain, swelling, and inflammation from sore muscles, joint discomfort, and injuries. With added support for relief and recovery from proven all-natural ingredients, including arnica, dragon's blood, cat's claw, and MSM. That sounds very Game of Thronesy with the dragon's blood and the cat's claw. But anyway, NAD took a look at the evidence, and there was not testing on the product to support these claims. NAD looked to the evidence here, and the evidence here only consisted of abstracts of studies performed on mice or rats or in vitro studies. And NAD noted here that the FTC guidance on health products notes that animal and in vitro studies, while possibly providing useful supporting or background information, are not sufficient to substantiate health-related claims without confirmation by randomized human clinical trials. So the claims were discontinued in that case.
And last but not least, oral care products. My late mom and dentist by training will appreciate that I'm talking about this. So one of the cases we looked at was a challenge by P&G against Essor Group for its Boca oral care products. Most of the claims were discontinued, but then the advertiser made new claims which were similar to the discontinued ones. So we looked at those claims. So, for example, the remineralizes enamel, helps fortify the surface of the teeth, and also claim as to the prebiotics to help maintain a healthy microbiome. And so in this case, so unlike Procter and Gamble's Crest and other similar toothpaste containing fluoride, Boca's toothpaste contains NHA. None of the advertiser studies tested Boca to support any of the challenge claims. As to whether there was a qualified ingredient claim that NHA remineralizes teeth could be supported, the studies were in vitro or in situ, which is sort of in between in vitro and in vivo. So they only provided preliminary data about the ingredient's efficacy and were not sufficiently reliable to see how it would work in the real world in vivo. There were 2 meta-analyses that were provided by the advertiser, which didn't provide enough information about the potentially relevant studies that could support a remineralization claim. There were no in vivo studies provided to support the whitening claims, and the meta-analyses that were provided, as with the remineralization, related to in vitro studies and provided little information about the studies. The prebiotic claim was also not supported because there was not a good fit between the claims and the support. So the ingredient was tested on the toothpaste, not the mouthwash. And then the in vitro studies did not show that the bacterial species tested were representative of the oral microbiome, and which contains many different types of bacteria. So all of the claims had to be discontinued. The advertiser appealed NAD's findings to the NARB, and the appeal is pending. Another case that we've looked at is a challenge by Oral Essentials against Guru Nanda for its whitening products. And I'm just going to focus on the claim enamel safe as it relates to the premium and signature whitening strips in the Pro Formula Whitening Gel Pen. We've seen a number of challenges and counter challenges regarding tooth sensitivity and whitening claims in recent years. The advertiser provided articles and expert opinions which don't rise to the level of competent and reliable scientific evidence to support a health claim, for the actual product. They did provide a placebo-controlled in vitro study assessing the white strips on the integrity of the tooth enamel, and they made it was a surface micro hardness measurements on polished bovine teeth blocks after 14 applications of a Guru Nanda whitening strip. And the results showed there were no statistically significant differences between the Guru Nanda product and placebo. In this case, the advertiser assessed the results in accordance with an ISO test method, but there's no evidence that was an industry standard test. And much of the literature referred to the need to use additional methods in conjunction with hardness testing to fully evaluate enamel erosion, which was not done here. So we recommended that the enamel safe claim be discontinued, and the advertiser agreed to comply.
So Annie, that was our health claims checkup. Before we go, let's give some tips to the listeners out there. First, remember the rules of the road. Take a look at NAD guidance, the FTC's guidance, and make sure that you have competent and reliable scientific evidence to support your claims.
Also remember that it is the quality and not the quantity of studies that matters. Multiple unreliable studies don't equal a reliable study. And even if you want to make a qualified claim, that also requires reliable support.
And when coming up with your claims, be mindful of your audience. Is it healthcare professionals or is it lay people? But even if you are advertising to healthcare professionals, the information must still be truthful and accurate about the product. Thanks again for tuning into this episode of The Ad Watchers. We hope you enjoyed it.
Join us next month for another episode of The Ad Watchers, As always, you can head over to our website, bbbprograms.org, to learn more about what we do at the National Advertising Division or any of our other self-regulatory programs. That's all for this episode. See you next time. Thanks again for tuning into AdWatchers. Be sure to check out our previous episodes at accountabilitystudio.org, Apple Podcasts, or wherever you listen to your favorite podcasts. And don't forget to subscribe to get notified about our next episode.